Hi, I'm Chris Winterrode with the New Mexico Aging and Long-Term Service Department's State Health Insurance Assistance or SHIP program. I'm here today with the June Medicare Minute, which is all about Medicare coverage of hospice. Hospice is a program of end-of-life pain management and comfort care for those with a terminal illness. In today's review of Medicare-covered hospice, I'm going to speak directly to patients as if they're the ones taking these actions or making these decisions. However, discussions about hospice often involve caregivers and family members as well. If you're a caregiver, family member, or a patient's appointed representative, you may be leading these conversations or decisions rather than the patient. Here's how Medicare hospice care benefit works. Medicare's hospice benefit is primarily home-based and offers end-of-life palliative treatment. Palliative treatment provides pain management services rather than curative care. The goal of hospice is to help you be as comfortable as possible, not to cure an illness. Services covered under the hospice benefit include skilled nursing and skilled therapy services, hospice aids and limited homemaker services, medical supplies, durable medical equipment, respite care, short-term inpatient care, and other services. Hospice coverage also includes any prescription drugs needed for pain and symptom management related to the terminal condition, while a Part D prescription drug plan may cover medications that are unrelated to your terminal condition. In order to elect hospice, number one, you must be enrolled in Medicare Part A. Number two, you must have a doctor certify that you have a terminal illness, meaning a life expectancy of 6 months or less. Note that another kind of healthcare provider, such as a physician's assistant or a nurse, cannot certify that you have a terminal illness for Medicare coverage of hospice. Number three, you or your appointed representative must sign a statement electing to have Medicare pay for palliative care rather than curative care. And last but not least, you must receive care from a Medicare certified hospice agency. Once you choose hospice, your hospice-related services are almost always covered under Original Medicare. If you have a Medicare Advantage plan, it continues to pay for any care that is unrelated to your terminal condition. Some Medicare Advantage plans participate in a special demonstration program to cover hospice care. If your plan participates in this program, then it will cover your hospice care instead of Original Medicare. Hospice generally takes place at home, with your hospice provider sending aides, nurses, and/or skilled therapists to provide the pain management services in your place of residence, which might be a facility like a nursing home, if that's where you normally reside. Hospice can sometimes take place at an inpatient facility if your hospice provider determines inpatient care is necessary for you. If your hospice provider determines that you need inpatient care, they must be the ones to make the arrangements. The cost of your inpatient stay is covered by the hospice benefit, but if you go to the hospital for hospice care and your hospice provider didn't make the arrangements, you may be responsible for the full cost of the stay. So how do you elect the hospice benefit and begin receiving care? If you're interested in Medicare's hospice benefit, ask your healthcare provider whether you meet the eligibility criteria for a Medicare-covered hospice care. If so, they can contact a Medicare-certified hospice on your behalf. There may be several Medicare-certified hospice agencies in your area. If the first one you, your caregiver, or your provider contact is unable to help you, contact another. Once you have found a Medicare certified hospice, the hospice medical director and your regular doctor, if you have one, will certify that you're eligible for hospice care. Afterwards, you must sign a statement electing hospice care and waiving curative treatments for your terminal illness. Your hospice team must consult you and your primary care provider, if you wish, to develop a plan of care. Your team may include a hospice doctor, a registered nurse, a social worker, and a counselor. Medicare covers hospice care for 2 90-day benefit periods, followed by an unlimited number of 60-day benefit periods. Doctor certification is necessary for each benefit period. You may choose to end the hospice benefit if you would like to receive curative treatment. If you decide you want curative treatment, you have the right to stop hospice at any time. Speak with your hospice doctor if you're interested in stopping. If you end your hospice care, you'll be asked to sign a form that indicates the date such care will end. Afterwards, you will again receive Medicare the way you did before choosing hospice, either through original Medicare or a Medicare Advantage plan. If you choose to end hospice care, make sure you provide your Part D prescription drug plan with written proof of the change so that it can update your status in its system. You can elect hospice again later if you continue to meet the eligibility criteria. Unfortunately, scams are a fact of modern life, so knowing how to prevent, detect, and report potential hospice fraud, errors, or abuse is important. Hospice fraud occurs when Medicare is falsely billed for any level of hospice care. It might occur if you're falsely certified as being terminally ill to be enrolled in hospice, or if you're enrolled in hospice without your or your family's permission. If you are eligible for hospice care, you could still experience fraud, errors, or abuse if your plan of care is not being followed. Some examples are not receiving skilled nursing visits during the last week of life, a hospice worker neglecting you, or a hospice worker stealing your medications. You can help to stop hospice fraud by first making sure a trusted doctor has assessed your condition and certified that you're terminally ill. Second, be wary of details that seem too good to be true. For example, never accept gifts in return for hospice care. Finally, report any potential fraudulent, erroneous, or abusive hospice care to your local senior Medicare patrol. You can reach your New Mexico Senior Medicare Patrol at the ADRC, the Aging and Disability Resource Center, at 1-800-432-2080. So to review, if you're interested in hospice, here are the steps you would need to take. Number 1, contact your doctor if you're considering electing hospice care to learn about your eligibility and local Medicare certified hospice providers. Number 2, contact your Part D plan and inform them about any medications you need for conditions that are unrelated to your terminal condition to avoid denials of coverage. Number 3, contact your SHIP program at 1-800-432-2080 to learn more about the hospice benefit and how to get your hospice care covered by Medicare. And finally, you can contact your local Senior Medicare Patrol if you experience potential Medicare hospice fraud, abuse, or errors. And again, they can be reached at 1-800-432-2080. End of life can be challenging for individuals and their families. Your local New Mexico SHIP and SMP is here to support you during this difficult time. You can reach us at 1-800-432-2080. Thank you.